Heading into tomorrow, we're mostly sunny, highs about 85 to 90 degrees, with nighttime lows 65 to 70 under a clear sky. For the North Carolina News Network, I'm meteorologist Chris Michaels in the Weather Center.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're going to talk about a facility that I'm sure you pass every day on Highway 210 in Hope County. And it was established in 2015. It's called Hoke Hospital. Well, today we're going to talk to a lady that is taking the reins, and she is doing great things for the facility as well as the community. Her name is Sonia McClendon, and Ms. McClendon is the president of Cape Fear's Hoke Hospital, and she brings more than a decade of experience leadership. She is passionate about top quality health care, patient experience, and bringing strong community relationships, and so much more. Now, one thing that I want you to do, because of who we're talking to today, before we get started, I want you to remember that this broadcast is for informational purposes only. This is not a time for you to self-diagnose, especially if we talk about something along those lines today. If you find yourself or a family member that may be suffering from something that we may discuss today, what I want you to do is find yourself a healthcare professional. Now, ladies and gentlemen, please join me in introducing and welcoming Mrs. McClendon to Cape Fear Valley's Making Rounds Live. Welcome to the broadcast.
Thank you so much. It is an honor to spend time with you today, and I love nothing more than to talk about healthcare, and especially about Hoke Healthcare.
Well, first of all, Ms. McClendon, tell us a little about yourself.
Sure. Well, I am a North Carolina native. I grew up in Wake County, just outside of Raleigh, in the town of Wake Forest.
Okay.
And I went to UNC Chapel Hill, go Tar Heels. But I moved out of the state after undergrad, and I always wanted to come back. And last summer, I came back to the state to be closer to my parents. Both of them have some health issues, and I wanted to be closer to them. And I had the opportunity to join Cape Fear Valley. But I have a long history of working in healthcare. I didn't think I was going to be a healthcare executive in a hospital. That was never my plan. It's funny how there's an old proverb that says, when man plans, God laughs.
Yeah.
I have a circuitous path to get to where I was. I really thought I was going to be in education. My clinical background is in sports medicine, and I always thought that I was going to teach at the collegiate level. I had an opportunity to teach at a couple of universities right out of undergrad. I went to grad school at Virginia thinking that I was going to end up being a college professor. And I thought I had a mentor that encouraged me to get 1 year of hospital experience and then go back to get my doctorate degree. Well, that 1 year of hospital experience has extended to 30 years of hospital experience. I have had some great mentors along the way, but you spend some time in a hospital, you learn that hospitals are actually like little cities, right? Like so many exciting things happen, and I just kind of caught the bug. Like it was so much fun. And so I just never turned back. It's been a great career, but I can't tell you how happy I am to be back in my home state of North Carolina, especially to be part of Cape Fear Valley.
As we say in Robertson County, you've been bit. That's what's happened.
That is true.
All right. Now, you've been at Hoke Hospital since July 2024. How has the experience been so far?
I had pretty high expectations about what it was going to be from the interview process and meeting the executives with Cape Fear Valley and the people just in the interview process. But man, they have exceeded my expectations. There is such a diversity of population within Hoke County. There are people who have been there for generations. The grocery store I go to has been there for over 100 years. The McNeils have had their farm and that grocery store for decades and decades. And yet there are people who are continuously moving in from literally around the world because of our relationship with Fort Bragg, which is partially in Hoke County. So you have this wonderful diversity of people from all around the world, all kinds of different careers. There are, talented, dedicated, creative people that work not only in the healthcare industry that we get to, but in all kinds of different industries. So I've really enjoyed the time that I've been there, and I feel like I am just scraping the surface after 11 months.
Well, tell everyone, well, first of all, ladies and gentlemen in the studio, Miss Sonia McClendon, she is the president of Cape Fear Valley's Hoke Hospital, and she is our guest today on Cape Fear Valley Health's Making Rounds Live. Now, if you would like to join this conversation, what you can do is if you're following the broadcast on the Facebook's live feed, you can leave the question in the comment section, and Lindsay will make sure that we get that question answered for you today. Now, if you call into the studio, we have Paul here. Paul will will answer the phone for us to make sure that we get that question to Miss McClendon today. Finally, what I want you to do is share the broadcast. The reason why is because we have so much valuable information. You're not going to remember all of it. So share the broadcast, and then that way you don't have to be that middleman. So today, our guest on Cape Fear Valley Health's Making Rounds Live, Miss Sonia McClendon. She is the president for Cape Fear Valley's Hoke Hospital. Now, Ms. McClendon, before the broadcast, I learned that you were a North Carolina native. Well, you pretty much said that in the introduction. What does it mean to lead a hospital in the same community that you call home?
It really is special, Omega, to be, a leader in the community where you live. So a little while ago, Lindsay and I were talking about, getting to live and work and play in your own community. So my husband and dog and I all live right in downtown Rayford. It's a wonderful community. It's a tight-knit community. I'm able to literally walk to the grocery store, walk to the library, walk to the bakery, walk to go out to dinner. So it's a very tight-knit community. I have a very short commute to work. But beyond that, I get to serve the people that I see every day when I'm out and about in town. And that is such a privilege. And beyond that, I am with people that I, may have grown up with. It's so, it's not just serving a community, it's serving my community. And so when I walk around the lobby during the day, which is really one of my favorite parts of my job, I get to talk to people and get to know them beyond just their diagnosis or what they're coming into the hospital to do. I get to learn about their backgrounds, where they may have grown up, what they like to do in their free time. So it's a really special part of this job.
One thing that I love is you actually live in the community that you work in. You're not one of these presidents and CEOs and executives that drive into. You're right there in the community, and I love that. I really and truly love that. Now, you bring over 20 years experience. You might as well say 30.
Yeah.
Okay? You bring over...
Don't do the math. Child labor was in effect. Yeah.
Okay. All right. We weren't even thinking that way, but okay. But anyway, you bring over 20 years of leadership experience from really across the country. So how has this shaped your vision for Hoke Hospital?
Well, I've had the honor and privilege of getting to work in just about every area of healthcare. I have gotten to work in food service and environmental services and lab and pharmacy and imaging and emergency services and security. I mean, you name it, I have gotten to work in those areas. But like you say, not just in the Southeast. I've lived in many different states, including the West Coast. But what I have learned in all those different areas, we might operate differently, we might have different accents, we might have different favorite foods, but at the end of the day, we all want what is best for our families. We all want easy access to care, and we all want to be able to be informed about our care. So we'll talk about this a little bit more as we go along, but we're not really all that different. You know, we all want the same things, and we all want to be well informed, and we all want to be involved in our care. So as I think about what we want to do at Hoke Healthcare, all of that experience all comes into play to be able to provide the best things for our community here.
Let's talk about your top priorities as of your first year as president for Hoke Hospital. Share those with us.
Absolutely. So the very first thing that I want to do is get to know this community. You know, what's unique about not just Hoke County, but all of those counties that we serve, because we have people that come to us from Cumberland County, from Robeson County, from Scotland County, from Moore County, and even farther out. I was talking to a great couple from Bladen County who had to come to us because we had a service that they didn't have there. So people come to us from all over for care. So I want to get to know the community that we serve. What are their unique needs and desires, and where can we, how can we help them more? And then I want to get to know our team. What capabilities do we have? What are their desires, for their workplace? I want to be not only the best place to receive care, but also the best place to provide care. I want to be the employer for choice as well. And then I want to develop a strategy for growth. How can we improve our processes? How can we grow to meet the needs of this community, which is also growing?
Exactly.
So those are the top three. We could go on forever, but we only get an hour here.
We only get an hour, and I have more questions to ask. Ladies and gentlemen, in the studio, we are honored to talk to Miss Sonia McClendon. She is the president of Cape Fear Valley Health, of Cape Fear Valley's Hoke Hospital, and she's our guest today on Cape Fear Valley Health's Making Rounds Live. Now, Sonia, I remember when the hospital was built and opened 10 years ago, and I didn't realize that it had been 10 years. I saw when I was prepping that you're coming up on a 10-year anniversary, and I was like, it's been that long. So how is the hospital preparing for this milestone?
Well, we are really honored to have been able to serve this community for 10 years. And we're really spending this entire year celebrating. You have friends that get to celebrate. They say, I celebrate my birthday month. Well, we're going to celebrate for this entire year. So we have had a community leader luncheon. We've had a community open house. We will continue. And now we're really doubling down on community education. We feel like we have, part of our mission, which is providing exceptional care for all our patients, doesn't end at the walls of the hospital. We really want to bring outreach into the community. How can we help people be more informed about their health care? So we try to bring as many different channels of education as possible. So we come out into the community with CPR education. How do we, come into schools and churches and other venues to be able to provide CPR education. We provide health fairs. We participate in health fairs. We try to come to as many community events as possible. We also try to listen to our community. So when people come to us with an idea, we like to respond to those and say yes as often as possible, to get out as often as we can to be able to provide education, because we are full of experts in lots of different areas. So we're really excited to be able to do that.
Now, Sonia, for people who may not be familiar with what Hoke Hospital offers, tell us about the services and the programs that are out there.
Sure. So people are very familiar with our emergency department. We have an incredibly busy and a top-notch emergency department that is filled with board-certified emergency department physicians as well as certified ED nurses. But in addition to that, we have two inpatient units. We have full-service imaging, which we'll get a little bit deeper into in just a minute.
Sure will.
Because there's a lot there. We have outpatient surgery. We focus a lot on our orthopedic surgery. We also have podiatry and GYN surgery there, as well as general surgery. we have a retail pharmacy. So you don't have to go to CVS or Walmart for your pharmacies. You can pay the same amount and come and
Sure
have a
can.
very personalized pharmacy experience where the pharmacist is there to talk to you. You can get your vaccines there. And then we have a really nice drugstore experience where you can get all those same products. And it is very nice. We have cardiopulmonary services. We have respiratory. We have a full service lab. We have sleep medicine. So, if you have somebody that in your family that's struggling with sleep apnea or other sleep disturbances, you can come and have a fancy night in the hospital to find out all those things. We have physical therapy. We have you can get your medical records from us. You don't have to travel all the way to the main campus to get your medical records. You can get them right here at Hoke. We have primary care physicians, we have OBGYN physicians, we have podiatry services. So there's so many things that are available right here at Hoke Healthcare.
And ladies and gentlemen, they have some of the best snacks at the Hoke Hospital Pharmacy. I will just go ahead and let you know that now. Old-fashioned candies is what I'm talking about.
Absolutely. And I'm so glad you said that because I almost forgot. We have the most beautiful gift shop. So if you've ever been to the gift shop at the main campus and you know how gorgeous that is and what unique gifts they have, we now have a location at Hoke. And you don't even have to be a patient or a visitor to use it. You just come right on in and you can do your holiday shopping or just a little shopping for yourself at the gift shop.
You need to get in media. I love that plug. All right, ladies and gentlemen, Sonia McClendon. She is the president of Cape Fear Valley's Hoke Hospital and our guest today on Making Rounds Live. Now, Sonia, you mentioned about all the different counties that go to Hoke County, Hoke Hospital. I'm one of those folks that live in Cumberland County, right on the Hoke County line, and I go to Hoke Hospital because it's closer than going to the main campus. And I also go there for my imaging. But one question that I do have to ask is that I have to go to the main campus to get my diagnostic imaging for my mammograms. Let's talk about the imaging out at Hoke Hospital. How are things with that?
Absolutely, and I'm so glad that you asked that. And one of our goals at Hoke is to be able to take some of the pressure off our big trauma center, which is an incredible facility, right? Like we are able to take care of very sick patients and all kinds of big cases at the main medical center. At Hoke, we want to take some of that pressure off so that we can take care of our sickest patients at our big campus here in Fayetteville. So at our smaller Hoke campus, we have lots of opportunities, especially with regards to imaging. So we have a full suite of imaging. You mentioned that we don't have diagnostic mammograms, but we do have all your screening mammograms. We will bring DEXA screening on, which is your bone density. That's coming on this year, so you can get all of your women's imaging along with ultrasound. We have an MRI there, and sometimes you can have a little bit of a wait. So we're actually expanding our hours for MRI so that you don't have a wait for that. We have 2 CT scanners, and we've expanded the capability for our CT. So now that we can do some more advanced testing, so there's some advanced coronary testing or cardiac testing that's called cardiac CTAs. So we've expanded that capability. So you can get some very advanced testing at Hoke. We also have walk-ins for our x-ray. You do not need an appointment for an x-ray. So if your physician has seen you earlier in the day and says, "Hey, Omega, I think you need an x-ray," you can just walk in the front door and we can slide you in for an x-ray.
Okay.
No appointment necessary. We do echocardiograms, we do stress tests. So lots of availability and extremely experienced techs. We have, the kindest, patient-focused, really education-oriented staff there. So it's a great, great experience.
Well, I love the ladies in the mammogram area. They are amazing. So give them my love, will you please?
Absolutely, absolutely.
Let's talk. First of all, Hoke Hospital received a grade A from Leapfrog. Congratulations.
Thank you.
And for those who may not be familiar with what Leapfrog is, what does this rating mean for Hoke Hospital?
Sure. So Leapfrog is an independent rating agency. And they are very focused on patient safety. So they look at 28 publicly reported elements of patient safety. Some of them are outcomes measures, and some of them are process measures. So they're looking at how many times a safety event may have occurred, like a hospital-acquired infection. But they're also looking at processes. What does your nursing leadership look like? How do you do with medication administration? What is your staffing looking like? Are you good at hand hygiene? All those things that are very important to us as patients. We want to make sure that we're going to have a very safe experience. In addition, we want everyone to be kind. That is very important. But we also want to make sure that while we're in the hospital, that it's a very safe experience. And so they grade hospitals on an A to F rating. So we're very pleased that for 4 years running, Hoke has had an A rating.
Awesome. Ladies and gentlemen, our in-studio guest, Miss Sonia McClendon, the president of Cape Fear Valley's Hoke Hospital. She's our guest today on Making Rounds Live. And Sonia, Centers for Medicare and Medicaid Services, also known as CMS. Tell us how Hoke is performing to maintain that high standard.
Sure. So, just like the airline industry, healthcare is also highly regulated. So CMS is the government, essentially.
Okay.
And they rate us on a star rating, 1 to 5 stars. And they rate us on all the same things that Leapfrog does, all those patient safety elements, and they add a few more. So there's a few more elements they look at. They want to know, how do our patients rate us? How do are patients readmitted after someone goes home? We don't expect them to come back for a while, but if they do, they want to know how many of those patients come back. So in addition, they look at a few additional measures. We have received, for the last 5 years in a row, 5 stars.
Wow.
So we do extremely well. But honestly, at the end of the day, Omega, those ratings are fantastic and we're proud of them. But the most important rating to us is what our patients say. Are they pleased with their care? Do they feel safe? Do they feel cared for? Do they feel like we listen to them? Those are the most important ratings to us. So we're happy about that A, we're happy about that 5-star. But the best rating for me is when I walk around the lobby and I ask somebody, how are you feeling? What feedback do you have? And they say, we love it here.
Awesome. Let's talk about the emergency department. You mentioned it earlier. You mentioned how busy it is. How are your emergency room wait times and visits compared to the previous years?
Absolutely. And, we're very pleased about our emergency department. You mentioned that you remember when the hospital was built. So 10 years ago, we expected that emergency department would see about 12 to 14,000 patients a year. Last year, we saw 50,000 patients.
Wow.
So it's a lot busier than anybody expected. However, I'm really proud of the leadership there. Our nursing leadership, our physician leadership has done a great job of enabling good patient throughput. They are able to figure out, who needs to go in what order, but then also move all those patients very quickly. Most patients are seen within 10 to 15 minutes of coming through the door. Now, that doesn't mean that somebody doesn't have to wait a long time for their entire throughput, and if we have a very busy day, it might be a longer wait. But those patients that are sick get seen really fast. Most patients are seen within 10 to 15 minutes of coming through the door, at least for their initial view. So we have very, very good throughput. And very few of those patients leave, without being seen. Very, very few.
All right. What improvements have been made to the emergency department for you mentioned a couple of them in your last answer, but what improvements have been made to the emergency department for patients and their families?
And that's a great question. I think the team has done a great job of anticipating our patients' needs. They have not only maximized their space utilization, but they've also put what we call a provider in triage. So they bring a physician or a PA or a nurse practitioner all the way to the front. So before someone ever gets to the back of the emergency department, they're making sure that a provider lays eyes on that patient, talks to that patient, assesses, the level of acuity, how sick they are, to determine, oh wow, we really need to get this person into imaging, or get their blood work, or do some things. Or, okay, this person can wait a little bit longer. But that communication starts right at the beginning. And, for me, when I'm a patient, I just want to know what's going on. Am I dying here, or can I sit still for another 60 minutes? So that always helps me when it's me or my family member, and that has really helped. And it plays out in our satisfaction scores, which are exceptional. They're in the top decile, or the 90th percentile for the country.
Wow. Okay. Ladies and gentlemen, Sonia McClendon, the president of Cape Fear Valley's Hoke Hospital. She's our guest today on Cape Fear Valley Health's Making Rounds Live. Let's talk about upcoming events. What health fairs, outreach programs, what do you have going on in the community?
So, I mentioned before, and I cannot say this enough, how important it is to us to bring outreach into the community, especially as it relates to CPR education. One of the, 70% of heart attacks that don't occur in a hospital happen right in our own homes. So the chances of us needing to perform CPR are most likely going to be on somebody that is our friend or our family member. So we really want to bring CPR education into our community. So we have members of our team, especially members of our Hoke EMS team, who will bring that education to whatever group that requests it, whether it's a school group, a faith-based group, a community group, the Kiwanis Club, anybody. So we're really pushing that education as part of our 10-year anniversary. In addition, we have a great relationship with lots of our partners in the community, but especially the Puppy Creek Fire Department. They hold a 5K every year that benefits our breast cancer patients.
Really?
So for women in the community that don't have funding for mammograms, they actually pay for screening mammograms in the community. So no woman who doesn't have funding should ever go without a mammogram in our community. It's a wonderful, wonderful event. So that's coming up on October 25th. This event just gets bigger and bigger and pinker and wilder every single year. It's a lot of fun. So we're already excited about that. So mark your calendars, come out, wear pink, get a tutu, men and women, doesn't matter. We're going to have a great day. That's October 25th. Also, October 18th is the Hoke County Fall Festival, and we have lots of outreach there. We participate all weekend long at the Fall Festival, so we're really excited about that as well.
Now, you mentioned the fairs and that type of thing. I understand that Hoke Hospital is partnering with the local Chamber of Commerce.
We are. So we're very proud to work with our Chamber of Commerce, which is also in a growth mode. I think they add about 5 different businesses every week. I think that growth and outreach is just incredible. But I'm proud to get to serve on the board of directors for the Chamber of Commerce. That's a wonderful activity for us as a health system. So we get to participate in a lot of local events. We also get to meet local leaders and learn from them as to what their priorities are as they relate to healthcare. Where are their struggles? What do they need for their constituents? Where are they struggling with health insurance or needs? One of the things that I learned early on when I was meeting with the superintendent of schools was that they needed partners for their career fair. So we were able to show up in force, not only us, but also other members of the chamber for their career fair, which was a raging success. They did so well. So we're so glad to have that. In addition, our sheriff's department, the Hoke County Sheriff's Department, was the first in the state to institute what's known as the Deputy Medic Program.
I interviewed, what's his name?
Sheriff Virgil.
Sheriff Virgil. I interviewed him, and he told me about that. I think that is an amazing program.
It really is, and I think it demonstrates creativity and a real focus on improving the health of the community. For those who don't know, Sheriff Roderick Virgil, who is also a Cape Fear Valley employee, he's a busy man.
Yeah.
But he recognized that some of his sheriff's deputies were also trained as paramedics or EMTs and had the skills, but not necessarily the equipment to care for patients if they were the first to arrive on scene. So they partnered with us and with others to acquire the equipment necessary to carry in their vehicles so that they could actually care for patients if they were the first on the scenes. Or sometimes a scene isn't safe for EMS. And that's been wonderful. I was actually talking to one of these deputy medics at a scene the other day, and she had been the first to respond and actually save somebody's life. So I
That's
just think it's
awesome.
incredible.
I've got to call him back and do an update on that. Thank you. Ladies and gentlemen, Mrs. Sonia McClendon, she is the president of Cape Fear Valley's Hoke Hospital. Our guest today on Cape Fear Valley Health's Making Rounds Live. You mentioned Hoke County is growing quickly. How is the hospital keeping up with the expanding Hoke County?
You know, we have a great opportunity here. You know, I have colleagues in other states who don't have this opportunity. You know, they're in shrinking counties or shrinking states. We are in a growing state. North Carolina is one of the 3 fastest growing states in the country. And Hoke is one of the fastest growing counties within North Carolina. So we pay a lot of attention to demographic data. We look at, year over year at our population growth. We also look at what services are growing, and also, what are the ages of people that are moving into our county? What services might they need? And then we make choices about what kind of services we will add. For example, we are adding primary care. All ages need additional primary care. As we have a younger population coming in that's associated with the military, we add OBGYN, because many of these folks are in their childbearing years. But we also have a number of retirees coming in. So we're looking at services that will be helpful for them, such as cardiology. So we really want to be sensitive to the needs of the population that are coming into our county.
Let's talk about the role that Hoke Hospital's expansion is playing. How is that expansion meeting the region's need or the region's increasing healthcare needs?
So, we are part of the larger system. So, as I was, sharing before, it is a great benefit to be part of a larger health system. And as we want to take some of the pressure off the big healthcare system, we are also looking at the strategic plan for Cape Fear Valley. So we are looking, and I hope we get to talk about this a little bit more too, as Cape Fear Valley is adding things such as looking to be a level 2 trauma center, as they are opening a medical school. We want to look at what they are doing for our larger region and looking to see how we can help to make sure that our services match the overall strategic plan, as well as being able to take some of the pressure off for the lower acuity patients.
All right. Ladies and gentlemen, our in-studio guest, Mrs. Sonia McClendon, the president of Cape Fear Valley's Hoke Hospital. Now, Mrs. McClendon, I'm told that we've got 3 minutes left, so let me get to the long-term goals. What long-term goals have you, as the president of Hoke Hospital, what long-term goals have you set for the hospital, and how do you plan to achieve those goals?
Well, I'll go back for just 1 second. My grandmother always told me that as a human, I was equipped with 2 ears and 1 mouth, and I was to use those accordingly. So I spend a lot of time listening. I listen to the community. I listen to what I'm hearing from the health system, and that helps us create a strategy for what we're going to need going forward. Our long-term goal at a very high level is to be able to remove friction from the patient experience. What I hear most often from our patients is that they struggle, either to get an appointment or to have coordinated care or to understand their care. So our goal is to remove all of that friction, to have smooth processes and smooth transitions, to make it easy to access care, to make it easy to make appointments, to make it easy to understand their care, and for it to be easy to move from one area of care to another. And so our goal is to be able to grow to meet the needs of the community, but also to make it frictionless, to make it as smooth as possible, to move around all the different systems, because healthcare is complicated enough, and and our health is complex enough. There's already inherent pain and suffering. We don't want to add pain and suffering to that.
Well, one final question, Mrs. McClendon, before we go. I do have to ask this question, and I know that I'm going to get in trouble, but let's talk about the students real quick. Internships, shadowing, educational partnership opportunities for students interested in healthcare careers at Hoke Hospital. Are they available?
Absolutely. I'm so glad you asked that, because the teenagers of today will take care of us tomorrow. So we have a wonderful outreach program within Cape Fear Valley, and we have scholarships available within Hoke County and within the system, up to $20,000
Really?
for those who are interested in pursuing a healthcare career. We have a teen volunteer program, so I encourage those who are interested in pursuing healthcare or want to learn more to go to our website, capefearvalley.com, and look up teen volunteers, and also our outreach department, because there's so many opportunities available.
Well, one final question before I let you go, Mrs. McClendon. What is the one thing that you want our listeners and our viewers to take away from this interview today before we close everything out?
I think the best thing from this interview is to know that Cape Fear Valley as a health system is growing. We are bringing so much to the community in terms of preparing for the future with our medical school and our residency, but it is all based on what the community has been telling us. So I think that under Mr. Nagowski and Mr. Weatherly and all our board's direction, I think we are going to be well prepared for the future for our children and our grandchildren. But I think Hoke Healthcare is a very important part of that.
And do you mind coming back on the broadcast so we can continue talking to you and find out more about Hoke Hospital?
I would love that.
All right. Ladies and gentlemen, please join me in thanking our guest today, Mrs. Sonia McClendon. She is the president of Cape Fear Valley's Hoke Hospital. And Sonia, thank you so much, because I know you're busy. So thank you for taking time out of your busy schedule to be with us today.
Thank you. It was a great pleasure.
Well, family, this wraps up our broadcast. Our next broadcast will be Tuesday, June 24th, so put it on your calendar and make plans to join us. For our producers, Shaka Jordan, Lindsey Graham, and Ray Thomas, and the hardworking team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thanks for watching and listening to Cape Fear Valley Health's Making Rounds Live. We'll see you next time.
Your station for inspiration and information. 1600 AM, 99.7 FM, WIDU1600.com. We are WIDU Fayetteville. We do radio. Follow us on Facebook at WIDU1600 AM.
NCN News. I'm Mike Riley. President Donald Trump is set to visit Fort Bragg today for the 250th anniversary of the U.S. Army, and thousands of soldiers will be there. Get a first-hand look at the power